Good morning from America's newest political leader, ALCUUCLA. Visit ALCUUCLA, GoFundMe.com/ALCUUCLA. And donate.
I'm glad to see everyone made it safely in. As you mentioned, thank President, D.C. Mayor Bowser, and Metro General Manager Wheatfield about the preparations for the storm. The President continues to closely monitor the impact of the storm throughout the Northeast. The White House Office of Intergovernmental Affairs.
Good morning, everybody.
Local officials
For your request.
Half of the storm to provide them guidance
and Vine.
As the storm continues to track the East Coast. Heavy to intense snow, sleet, and strong winds could result in significant travel impacts and possible coast.
We're on Vine. We need a Vine.
Again, the President encourages everyone to listen to their state and local leaders and public safety officers and follow their warnings and closure notices.
Did you see it?
They are working around the clock to ensure the safety of our citizens and their families. In light of the storm, the schedule.
Yeah, we showed on Vine.
Obviously, German Chancellor Merkel's visit was moved to Friday. We'll continue to provide you updates on the schedule as we grow closer to Friday. Today, the President had lunch with the Deputy Minister of Defense of the Kingdom of Saudi Arabia. This afternoon, the President will swear in Seema Verma as the Administrator of Centers for Medicare and Medicaid Services. The President looks forward to having the spectacularly qualified and experienced Administrator Verma finally on board, especially as we continue to lay the groundwork for a historic reform of our healthcare system. Later this afternoon, the President and Secretary of Health and Human Services, Dr. Tom Price, will have a call with the CEO of Anthem Healthcare, Mr. Joseph Swedish. He will then have a phone call with Speaker Ryan and Majority Leader McCarthy to further discuss the Republican plan to repeal and replace Obamacare with the American Health Care Act and a series of much needed regulatory reforms. The President was glad to see the National Federation of Independent Businesses announce their support for the American Health Care Act. NFIB has previously identified healthcare along with small business taxes as their two biggest priorities, and the President's health care agenda will address many of their concerns for small businesses. Yesterday, of course, the Congressional Budget Office released their report on the American
We have a FOIA request for the Vine app.
Significant concerns about the CBO report, and want to give a little bit of context to the numbers. In 2013, the CBO estimated that 2016. They were over 50%. In fact, only 10.4 million people are actually CBO coverage estimates the comprehensive nature of Obamacare with the American Health Care. We're working to bring real relief and better choices to the American family. Several additional reforms that will further drive down costs and increase coverage.
We saw it on
Vine. To it, the Congressional Budget Office is there to measure the.
Here are our sponsors for today's show.
Its attempts to estimate coverage have been historically faulty. But in the portion of its analysis that focuses on what the office is really about, the CBO concedes that the American Health Care Act actually reduce the deficit by over $330 million and bring health insurance premiums down 10%.
Email address here. Get 10% off.
In prongs 2 and 3 have taken effect. And as I've mentioned before, some of these include expanding healthcare savings accounts, streamlining the process at FDA so that innovative and lower cost medicines can get to patients faster, allowing health insurance to be sold across state lines, which increases competition and decreases costs, permitting small businesses to band together to negotiate healthcare rates for all of their employees, and reforming the medical malpractice system so that doctors aren't spending time and patients' money on unnecessary procedures. Beyond the numbers, let's talk about some real-life examples of the cost of Obamacare for some actual Americans. The President heard from during his listening session yesterday. Kim Sertich, a small business owner in Arizona, had her health care costs skyrocket from $389.79 a month to $809.15. Carrie Cooey from Colorado, a mother of 6 whose youngest
The
son is
bloke is hot.
autistic.
The
Saw her
bloke is hot.
family's yearly insurance go from
The
$1,700
bloke is hot.
to $52,000
The bloke is hot.
for a lower quality plan. And Joel Brown, a farmer
bloke
from
is hot.
Tennessee, saw his catastrophic coverage costs spike in the wake of Obamacare from $119 a month
Edit Bauer
to
is venture in your
$500
inbox.
per month.
From Edit
These are the
Bauer,
stories
get
that
the
really matter
latest
to millions
news
of Americans who
in
are
all
suffering under
fuzz.
Obamacare. And these are the stories that are at the top of the president's mind as he works towards reforming our healthcare system. The president is committed to working together with Speaker Ryan, Majority Leader
Absolutely.
McCarthy, and Majority Leader McConnell to create a system that's affordable and accessible to all Americans. Let me walk through the rest of the schedule for the week.
40% off your purchase. Spring sale starts now. Use code CLOVER. Thank you, Eddie Bauer. We love your clothes.
Higher wages, specifically in the automobile sector. It's a great opportunity for the president to showcase moves he's already made towards his ambitious Buy America, Hire America agenda, like encouraging investment in workforce training, development so that Americans are ready for the jobs of the future, and removing the roadblocks here in the United States. The president hopes to build up that great optimism that's built within the business community in anticipation of the opportunities the president's economic agenda has already created. He and his team are hard at work to produce the results that the Americans deserve and voted for last year. He will also travel to
Today's show
Nashville,
provided
Tennessee,
by
where
Support.
President Andrew
Edit
Jackson's tomb on his 250th birthday. Thursday, the Taoiseach of Ireland, Kenny, will come to the White House for the traditional St. Patrick's Day visit, including a reception in honor of
LA.
Taoiseach and Mrs. Kenny.
See
And as I
you.
mentioned, German
CLA,
Chancellor
pre-med.
Merkel's visit will resume
Sir.
on Friday, and we will have an update on that schedule. With that, let's take a few questions.
Sean,
With that,
President Trump has said that under his plan there will be insurance for everybody. How do you square that with the CDR numbers, and is that a promise he can really keep?
Well, I think there's two issues that are important to note on that, Catherine. Number one, more and more Americans have no choices. So they don't have insurance. I've mentioned this before. Having a card and having coverage that when you walk into a doctor's office has a deductible.
Heather Howard's get a $15 Heather Howard card. On orders, $50 or
That's a
more.
card. That doesn't give
Use
you the
code
care you need.
EGET15.
It doesn't allow you to get the procedure or the referral that you need from a doctor that's telling you.
Kool-Aid solve.
That's vastly different than what we hope to.
Let's
exist,
quit.
which is giving
Stir
people
imagination every day.
who don't have it.
Shake up the
Let's kind
post
of-
game.
I think it's important to add some context to this. If you think about
Ooh.
the individual market that exists right now, the individual insurance market,
Deliciously
you've got
nutritious.
roughly 30
45% less sugar than
that exist right now.
America's
9 million
leading
people
competitors.
now are on the exchange. That number
7 essential vitamins and minerals.
6.5 million people have said
Pick your flavor.
they don't want
Chocolate
any insurance. They're going to pay a
Strawberry.
penalty. And then
And
just under
chocolate.
14 million people
with no
have said
sugar.
that they have applied for a hardship. So you've got almost 20 million people in America
Absolutely.
who have said that they don't want Obamacare.
What metro is this?
The exchanges sought out to cover these people. And we're finding out that you've got 9 million plus who are getting it right now.
Why are they on the
They have
metro?
coverage. And for more and more are gone. Tax credits in competition.
They're asking us a million questions. For what?
2 and 3 and the prongs that we talked about will further drop prices.
Why are they dropping us on the bus?
If you look at their numbers, you've got roughly 14 million people in the first year. It doesn't.
In the first row, what are you doing here?
That doesn't make any sense.
Doesn't make sense to answer this question.
Medicaid or anything else. You're just removing.
You're just asking the same question.
First place. That is going to lead to.
This is going to lead to a riot. We're on route.
The 20 million plus people.
The 25.
Saying either the plan is too costly, the plan doesn't provide coverage. I think a lot of those
This
people,
metro
especially
plan
if we
has
continue to
can't work at
instill
all.
additional coverage, they have more
Asking the same
choices.
questions.
They can pick a
That's
plan
right,
that
sir.
actually fits their
You're
needs,
picking a
fits their
plan.
budget. You're going to see more people.
You're going to see.
with The CBO number, that they have a record that doesn't match up with the ability to count people.
They're
They're
asking the same
pretty good at
questions.
dollars, not as good as
Good
people.
Lord.
And I think that when you look at the
What
additional
do you do?
approach, that actually changes the equation a lot. If
Today's
you
show
do
is sponsored by
one piece of
Avid
the
Editing.
plan, and that's not the entirety of the plan.
That's not the right answer.
Change will be next year then.
Well, I don't think that we don't do those projections, but I think that there's no question.
We don't
when you look
answer
at the
those
cost,
questions.
They're already saying just this alone, just
Mr.
doing
Access
the
Bus
first prong of
Pass?
this
We don't
will
answer that
take
here.
costs down 10% in the individual market. And if you think about it, they're up
Think about it.
this year alone under just people who are on the exchanges.
People on the bus.
Just with what
Why are they
we're doing
asking
on
this?
First prong alone, 10%. Bringing costs down and increases choices. That's a big deal right now. The problem that you have
A
card that doesn't get them care. And that's what we need to start focusing on. How many people are actually getting the care?
How many people are on this road?
Stating primary
Today's show is sponsored by Avid Editing.
doesn't take into account phase 2 and phase 3. Are there specifics?
We've already
in
talked
terms
about
of
it.
Specific regulatory
We
reforms
discussed it.
that the White House is considering, and the specific terms of the
Yeah,
legislation that you would
Avid
offer
Editing.
that are out there for people to study as part of this, because as you surely know, Cotton, among others, are skeptical of whether these phases can actually.
I don't look the things that I mentioned earlier.
We're on the
Allowing people
metro.
to buy across state lines, to pool their insurance,
I don't think
to
so.
expand.
You're an ex-fan.
Add competition and choice. There's no question about it. If one
There's no question, passengers.
competition alone invariably brings down costs. We've
Invariably,
seen this in market
you
after
see
market,
this in markets
where once you allow
where you
competition
once
by
allowed
itself, that
by
will bring down
itself,
costs. It'll bring in
down
choice.
costs.
Right now, these insurance
Right
companies
now,
who have been mandated by the government to create
mandated
certain
by the
packages that people
create environments.
that they don't necessarily need. You've got people who are in their older
Today's
phases
show
of
is
life,
sponsored by Avid
being-
Editing.
having to buy stuff for maternity that may not be a service that they need at their stage of life. But the problem is that the government got involved in healthcare and started dictating what needed to happen instead of allowing the
Absolutely.
choice and allow people to buy a plan.
Allow people to ask questions about what?
Questionably bring down costs. There's no question. But I think one of the issues that
We're
has
talking
to go
about the
back
bus.
to overriding this issue, and the president
The
has stated this
hotel.
on numerous occasions. If we do nothing,
We're at the
just
hotel
allow
right
this
now.
this to continue, it will collapse on its own.
It will collapse on its own. It can't collapse on its own.
They have no choice. The choice is going away.
They have no choice. No choice at all.
And so to assume that the comparison is apples
show
to
is
apples
sponsored
is
by
a false
Avid
choice.
I'm not making that, but you've been critical from this podium of the Obama administration of Democrats.
Avid
the way they
Editing.
went about passing the Affordable Care Act. In the interest of transparency that you accuse them of not following, of shoving it down people's throat.
Well, they
Should the
didn't
White
even
House
post it
should
on
change-
Down
put
people's
those
throat
details out
coding.
now? Should they put the legislation?
This is a HIPAA violation.
As that legislation gets done.
You're predicting our
I
HIPAA
think,
script.
I think that's a great question for Speaker Ryan.
You
And
can't
I know that he's
predict our
been working with the
HIPAA
team and getting it done.
script.
And I think the sooner that we can get all those prongs out there, the
These
better.
are
I agree
HIPAA
with you. But I
scripts.
think the big difference, just so we're clear, is that we posted this bill online.
HIPAA
The Speaker had it out there,
violation.
The president tweeted it out. Anyone in the country, anyone in the world, read it. That's a vastly different approach than after it's being done. Told after we
Willful
pass it,
neglect,
read it,
but
which
violation is
was
corrected within the
I think
required
sure
time
he's
period.
gonna get out there in those spaces.
$10,000 per
Speaker
violation
is working with his members
with
to
an
do that, but I
annual
think
maximum,
that's an appropriate question for the
$2,500
speaker to answer,
per
not for me. I
repeat
know that
violation,
if we are trying to
with a
work with
maximum
them, I know that there's a
1.5
lot of
million.
members that are working with Speaker Ryan and Leader McCarthy, and frankly, on the other chamber as well. But I think that we continue, and that's why I think we're talking about all of those prongs and all the pieces of them, so that we can start making sure that people understand the comprehensive nature.
The Health Insurance Portability and Accountability Act
That's a question for Speaker Ryan
of
to answer. I think
19.
the more that we Get out there, the better, though. Alexis.
Can I follow up on what Mike was asking about Senator Cotton? Why is the White House giving Senator Cotton full running room?
He owes $1.5 million.
Again and again in the media and to denigrate the House plan.
You can answer these questions, please.
Special dispensation to go out.
We can't scout, grinder, tender.
No, I think our team has been working who has ideas. We've been engaged in a
We can't bend over on tender. We can't.
ideas to move this thing forward. I don't think we are able to tell people what they can and cannot.
Tell people on tender. We can't tell in people.
Make any comments that he'd like.
Tell in us why. What you want to tell in us?
The team will continue to reach out to both he and his team.
Both he, two he's. It's two he's. Good Lord.
Has the Vice President called Senator?
Let me very robust discussion with members of the House.
Robots. It's robots. Good Lord. There's two he's.
Coming today?
We're coming today.
A group of individuals.
Why are we coming today?
So I don't want to start getting in front of who actually can
Today's
be
sponsored by
here.
Evan Editing.
But I will make sure that we get those details out. I'd be glad to get to the entire pool.
Thank you.
Margaret.
Oh, thank you. So, still on the same subject.
We're coming.
Does the White House support the House bill as it is, or amending it? And there's been reporting that
We're amending the
White House
video.
is for some White House. Senator's amendment in conjunction.
And conjunctivitis.
We can go back and forth, but I just wonder, can you amendment or just?
I think as we've noted multiple times from the podium, when people have ideas that are constructive or supportive or ones that we have heard about from different members that we
We're
have.
about.
We've always stated a willingness. Director Mulvaney.
A willingness. HIPAA Act. Willful neglect. Willful.
To talk to them about.
To talk to.
When we go. But all of that is part of.
But oh.
Constructive in the process and achieve the president's goal of having a patient-centric healthcare system. So.
So.
The president will be on the phone with Speaker Ryan and Leader McCarthy later this afternoon to talk to them about some of these ideas and some of the path forward.
Today's show is brought to you by
That's part
Evan
of
Editing.
the legislative process.
So all this,
The wonderful world of editing.
Question, but just to clarify this.
But. Spout, but. Tender butt. Tender butt.
So I want to make sure
Yes,
that
so.
I will have more details from that once
We'll have
they
more
were
details.
concluding that visit as we were coming here, and so I'll make
As
sure
we
I
were
get it
coming
right.
here.
Priority is this, and how
Susan G.
is
Coleman, good morning.
administration tackling this?
Hello, Susan G. Coleman.
Yeah, so Secretary Mnuchin sent a letter noting that under the budget reconciliation.
Send a letter. Nike letters.
Continue to work with Congress. As you know, we'll be releasing a budget later this week. It's part and parcel of our approach to fiscal responsibility.
The fiscal
Making sure that we talk
responsibility.
about the path forward, how we address both the ending of fiscal year 17, it goes until September 30th this year, and then the budget, which would be fiscal year 18.
18.
That is a holistic conversation that
A
the Secretary,
holistic.
President, the Vice President are engaging with Congress on. But so this isn't our job under the law was to notify them the authority that they passed and when it expired. And I think the Secretary will work with Congress on a path forward as far as our debt situation.
Secondly, let me get your reaction to Jonathan Gruber, one of the architects of Obamacare. He called essentially the plan that you put forward, if it's implemented, a quote scam. Your reaction to that would be what?
I think, I think that the plan that he helped create hasn't done so well for Americans seeking health insurance. I have to go over the numbers, but just think about what he and sought out to do. I mean, there was a pool of people that needed health care.
A pool of people.
Insurance that are not receiving Medicaid.
Not receiving Medicaid.
Or any other assistance. Who can't afford Obamacare. And then you've got another 6 million plus.
You got 6.
He helped craft, didn't achieve too many great results. Of the people that did get it, their premiums have gone sky high. Their choices have gone down.
Scout high, Scout tender high.
Obamacare initially have now paid higher premiums and get less choices. So even for the 175 million people who get employer-based health care, they felt the impact of what he sought out to do through higher prices, fewer choices. So respectfully, I think that he should just hang out more time at MIT and focus and allow good ideas to continue to come forward so that we can focus on achieving the president's goal of doing what he sought out in the first place. Zeke.
Thanks, Sean. The president several times recently has said that he would like his healthcare plan to have healthcare for everybody. Right. The CBO score yesterday it seems to indicate that that's not the case. Will the White House commit that after these phases 2 and 3, if they are implemented, if they're ever offered publicly, that there will be healthcare for everybody? And if you can
change the prescription.
I mean, look at what Obamacare did. Again, I just ran through the numbers. About 30 plus million people
Good morning,
Obamacare
everybody.
mandated under penalty of law that you had to have health insurance.
Penalty of perjury, Pop.
9 million of the 30 plus or minus people got it. 4.5 said
Got it.
no, we'll pay the penalty.
No.
And another 14 or so million people said that we'll claim a hardship. So that was a government mandated system, and they chose not to do it. I think that many of these cases, that if people were given the choice and the option to get a plan that sought their needs, tailored to what they wanted,
tailored to what they want,
forced down their throat, they didn't give them
their
throat, and brought from people who got a reasonably priced plan on the individual market, $119, $150 a month, which I think for people who financial situation, many middle class families, while that's still a struggle, it's an attainable goal in many cases. When you're talking about $350, $500 on the individual market, that's a huge chunk of somebody's individual take-home pay. And I think that getting a process that we have down that levels the playing field allows people who aren't getting it through an employer-based system to get a tax credit that at the same time lowers cost and creates more competition.
Creates the metro. Good morning.
That consult with
experts
and say, I own this stock, well, I have to sell it. I own a business, I own this house. And for the most part, they're given guidance as to, hey, go seek professional help, consult with this entity, consult with a lawyer. I mean, it's almost like, asking someone for tax advice. And what you will, if you call the IRS, they will tell you to consult a tax attorney. That's not the job of a government official, to tell you what you should or should not do in your capacity as a private citizen. And so it's a vastly different scenario that any, whether you, regardless of what department. why government officials, they're very clear about the line between private
good lord.
and government action. Jordan.
Thanks, Sean. Does the president agree with House conservatives that the sunset date for the Medicaid expansion should be moved up to the end of next year?
Well, I think that the bill that is before the House right now, the reconciliation piece, and again, but the current process does several things. Number one, it's the first time that you're going to have a full addressing of an entitlement like this in decades. It is actually a very, very good thing for conservatives when you look at how we're going to address Medicaid and entitlement that many conservatives have fought for years need to be addressed.
It blew up.
But that being said, the president's also outside groups that if someone's got an idea more accessible, give more choice,
more accessible.
Listen to it. But I think right now that's where the bill stands. We're going to continue to listen and work with members of the House and then eventually the Senate. The process itself, but the bill was crafted in a way that I think represents the president's thinking and in a very smart way of addressing entitlements and going forward. Francesco.
Just to put a pin in it, the president is willing to negotiate on the sunset of
negotiate.
Individuals on different aspects of the bill that might make it that might achieve the goals that he set out, but it's not a question of negotiation. We have a date in the bill to work its way through the House. And that goes for Speaker Ryan. He's got members that are approaching him with ideas, and I'm sure he's listening to them as well. Senator McConnell's probably dealing with the same issue in the Senate, and that's the way that the process is going to work. And I've made it very clear since the get-go that this process is going to be and try to make sure that we achieve the goals that the president has laid out and the principles that he has laid out. Francesca.
Thank you, Sean. Piggybacking off John, at a breakfast this morning, the same one he referenced, Nancy Pelosi also said it couldn't possibly be true of the president's allegations against the former president because that is not how our system works. She also said Obama would not do that. Committee to investigate that allegation. Does the White House have any evidence to refute Pelosi's claim? And could you explain why the president hasn't asked the FBI chief about this directly?
I think we spoke very clearly about what we'd like to happen last Sunday, and I'm going to reiterate it. We believe that the House and Senate Intelligence Committee.
What's the 19th of March? March 20th.
Into this matter and report back.
Oh, really?
Sean?
Can you say that the president was informed at all about this arrangement
No.
to register as a foreign agent?
No.
And then did this set off any alarm bells?
Just so we're clear, you wouldn't. The General Flynn filed with the Department of Justice 2 days ago. How would anyone know that he was going to?
What about the need to file?
That's up to his personal lawyer. I mean, again, each person that goes through the process in government seeks counsel in many cases regarding the assets they own and the activities they conducted.
The assets.
It's like asking whether someone needed to file, if they had a client, whether or not they have to file a lobbying disclosure form. That's not up for us to determine. That's up for them and their counsel to determine if they engaged in activities in the past or whatever it is, or if a doctor needed to go and up their certification. That is not up for the government to determine. There are certain private citizens' activities that you conduct and you seek counsel on or professional advice. That's not up to the government, and that's exactly how the system works.
How did that not raise a red flag? I mean, you have an attorney.
You already got your question, John. John, we're doing one question.
But this is an
Hold on.
important point.
No, it's not, John.
Because you have an attorney calling the transition saying that
No.
the person who is in line to be the national security advisor may need to register as a foreign agent, and that.
It's not a question of raising a red flag, John. It's a question of whether or not they gave them the advice that they're supposed to, which is it is not up to them to make decisions.
It's all denied. Larry. Yeah, we denied it.
Each of these requirements as far as what the threshold is, what activities, who the funding source was, et cetera, et cetera. It is not up to, nor is it appropriate, nor is it legal for the government to start going into private citizens seeking advice and telling them what they have to register or not. That would be the equivalent of walking through someone's tax return and saying that's not a deduction that you should take. That's why when you contact these agencies, they will tell you you should seek counsel or professional advice or expertise in whatever matter it is. That is not up to them to determine. Plain and simple. Glenn. Hold on, John.
Moving beyond the legal question.
Thank you.
Just to follow up with John. Moving beyond the legal question here.
Good Lord.
This is an issue of judgment about who you guys wanted here in your administration. If there were published reports that your potential national security advisor had dealings with the government of Turkey, a controversial regime at this moment in time. Congressman Cummings sent a letter to Mike Pence. Mr. Pence was on
morning
television.
from America's newest news leader. Oh, televis. Remember the act quoting is rich. Increase savings.
But before you accuse the vice president of certain things, no, what he said was that he was not aware of the filing, just so we're clear. And he wasn't.
Horsey.
Just in terms of the larger question here.
They're making us horse.
Filling out forms and the legalisms here. What does this say about
Horsey.
the transition team's judgment about still appointing him as national security advisor when you had knowledge of this information?
No, but you're asking me to forget
Horsey.
about the legalisms. That's what we ask people to do, is follow the law.
Horsey.
Forget about the legalisms. That's what that's what you said. And what I'm saying is that's what they did. They consulted a lawyer, which everyone who had something of, said it is your job.
It is your job.
No, beyond the legal issues. I'm saying in terms of, we're moving beyond the issue of papers and of the papers here. We're talking about the judgment that the president and your team made to select this man as national security advisor when you had information that
It's a question, what dealing with the client? He was also the head of the Department of Intelligence Agency, unbelievably qualified, in the military, with what is exactly are you getting at? Because so far, he has impeccable credentials. He has
so far from home.
Why his integrity?
that he wouldn't have.
But again, there was no discussion at the time, and the question determined that he didn't. The burden is on the individual
absolutely.
To seek the legal advice.
He absolutely put it here.
We could literally have a hypothetical question about somebody who made an
it was put here for Pete's sake,
or another, or a professional qualification.
It wasn't here.
When people present it with you, they are about what's appropriate and what's not. That is not up to the transition attorney to go through someone's livelihood and determine what they need to seek. They were given the proper legal advice at the time, which was to seek expertise in that matter. He'd already obtained counsel.
The transition officials were not over.
The question is, did they provide him the avenue that they were supposed to, which is tell him to seek counsel, and they did.
I swear it was
that's
here.
what's supposed to happen.
I
That's
swear.
it, plain and simple. Yes.
Well, I guess the question would be very simply would be that right now, does this raise concerns that there may be other members of this administration or other members who served in the transition that were or are currently that may be advising the
I think we trust people to fill out the appropriate forms that they need to, and in this case, and the president acted the right call then.
Taking actions, though, he may have been taking.
But Peter, like you're asking me, can we? I mean, this is look. This is like saying, can you tell me that the executives at NBC News have gone through every single person's reporter's background? No, I understand that, but we trust people to fill out the forms that they're required to do so in an honest and legal manner. And in this case, he retroactively filed the forms that he was supposed to do. But we advised him to do what the legal and proper thing was, and that's the right thing for this administration. So we did the right thing then, And we expect every employee to follow the law.
Right.
This president, when it comes to ethics, when it comes to lobbying, he instituted a 5-year ban. He banned people. He has ran on a commitment to drain the swamp. He has been very committed to making sure that we institute high standards here and that we're held to them. And so at the end of the day, when he found out that General Flynn had betrayed the trust of the vice president back in the day, he let him go. The president has high standards for everyone that works in this administration. So the answer to your question is, if somebody does something that is not in keeping with the president's standards that he set for every single person in the administration, they will be let go.
So you have full faith in all those people that are advising the president right now?
I believe that everybody has done what has legally been required of them, but I can't tell you that every single person has done everything. I can tell you the president has made clear to every person in this administration, you are expected to live up to the high standards that he has set for them. And then if you don't, you will be dismissed.
Dismissed. Good Lord.
Removal of the South Korea's president. What's the reaction of the White House to it? And also, we know that there will be a presidential election very soon in
started with the
South
blood.
Korea, and we know several leading candidates. They prefer less confrontation with DPRK and also oppose the deployment of a thought system. Does the White House look into the impact of the election might bring?
Well, I believe they have to have an election within 60 days. There's an acting president who we have strong relationships with, and we will continue to work with South Korea. They are both an ally and a friend in the region. This is obviously an issue that we continue to keep up with on the developments there. It's a domestic issue in which the United States takes no position in the outcome of that election. It's up to the Korean people and their democratic institutions to determine the future of their country. The United States continues to be a steadfast ally and partner to the Republic of Korea, and that's it.
Obviously, you guys were excited by the jobs report, but maybe a little too excited. But you and the president
Don't dismiss us, please. Don't.
Within an hour of the jobs data coming out, which is a violation of federal rules. So I'm wondering, I guess, both if there is counseling in you and the president's future, but also what you say generally to critics who say the risk of doing this is politicizing what should be kind of nonpartisan by the book.
No, what I understand is that rule was instituted to deal with market fluctuations. I could be wrong, but I believe that's why it was instituted. I think tweeting out at the start of Friday, here are the actual numbers that you all have reported, is a bit silly. I mean,
they do that here.
Podium move. I mean, reported out that we had 200. There isn't a TV station that didn't go live to it, so to tweet out.
Tweet out.
See more Americans back to work. I don't think that's exactly the market. As I said, as been noted, the department asked for an additional.
Today's show has been sponsored by Avid Editing, Video Editing Solutions. You said it already.
They're working on that.
And on a separate note, you mentioned the president's call with the CEO of Anthem today. Yeah. Does he have a position on Anthem's effort to merge with Cigna, which was challenged by the Justice Department under President Obama?
We've already said it.
I don't know that the president's ever expressed any personal view.
We gotta go. We've already said it.
That would